Anxiety knows no age limit, but the way adults and children show it differs. A new documentary series based here in Kansas City wants us to pay better attention. We meet the man behind this mission and hear his remarkable story just ahead. Good morning. It is Monday, August 29th. I'm Jessica Lovell. Welcome into the Morning Medical Update. We are live here inside the Dolph C. Simons Jr. Family Broadcast Studio. COVID and monkeypox cases are still with us, of course. We're going to see how we did over the weekend. Check in with Doc Hawk. Last week, the FDA approved a new drug to treat major depressive disorder, the first of its kind in 60 years. So we have a lot to talk about today. Our experts include the founder of the Freedom Project, Abraham Cisse. Also, we have Dr. Tyler Trivestad. He is the Director of Comprehensive Depression Assessment and Treatment Clinic here at the health system. And we have child psychologist Dr. Tyler Dragey. They are ready to answer your questions, so please get them sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to those right there on your screen. A question for all of us. Yikes. Okay, it's Monday. A question for all of us this morning. Does mental illness prevent us from living, or is it proof that we're alive? That's the focus of a brand new documentary series based here in Kansas City.
When you're a child and you're going through trauma, you have no value.
Trauma, especially for a kid, is a lifelong sentence unless you deal with it.
It is called Freedom Project. The goal, rethink mental illness and get people the support they need. The University of Kansas Health System is one of the sponsors for the premiere of this documentary at the Kaufman Center for the Performing Arts. Abraham, good morning. You are a former professional soccer player who founded this project out of your own personal experience with anxiety that was brought on after being uprooted from your home and your family living in Africa. So you speak openly about the isolation that you suffered and trusting the wrong people. You call the Freedom Project a mental health startup. What do you hope to accomplish through this?
Yeah, first of all, thank you for having me. It's an honor to be here and, speaking to, you guys and your audience as well. And again, thanks, thank you so much to KU for the University of Kansas Health System for jumping on board as a, one of the sponsors. But yeah, so I just a trigger warning, I actually lost one of my best friends back in 2020, due to violence. And I just basically made a conscious decision that I'm going to do something about it. So the goal now with the Freedom Project is to end violence in general. So I do that through film, and also I use technology because that's my background in order to talk about this problem. So as an athlete or a former athlete, I use that avenue as a way to reach as many people as possible, because sports is one thing that we all really deeply care about. And as a former athlete, I used to remember people wanting to take pictures with me, and that concept always blew my mind. So I'm just like, what's the best way to tackle violence and also talk about mental health?
So what is it like? How does it feel for you to watch this all finally come together?
Wow. Yeah, it's been 6 years, and I had to go through a very challenging process, because I'm also a dad. Even this month of August, I had to find people to watch, my son, and just so that I can focus and go all in, be able to actually do this. So yeah, it's been very challenging and very humbling at the same time, because I came in with a blazing hot saying that I'm going to fix this problem. But then the more that I learned about the system around mental health, and I had to double down a little bit. That's why it's taking me 6 years. And unfortunately, with COVID, I've lost almost 4 people through this process. So yeah, it's been a very challenging process. But I think the fact that I'm aware of therapy, I'm aware of mental illnesses, I'm aware of my own mental illnesses, it's been a very beautiful process at the same time.
Yeah, you have a true perspective. So this documentary plans to address core community issues like pediatric and adult mental health, burnout, violence, and homelessness in Kansas City.
Yeah.
That is a lot to unpack. I want to bring in Dr. Trivestad. Where does it begin? What do we need to know about mental health and anxiety among adults?
Yeah, so I think it's important to distinguish between normal anxiety that every human being is going to experience, and in fact, anxiety can sometimes be a very positive thing. And so I think of anxiety on a bell curve distribution, right? If you have too little anxiety, you're not motivated to do anything, you're not engaged, you don't really have that gumption to get up and go. And then on the extreme end, you have too much anxiety. It's crippling, it's too much fear. The classic example in psychiatry is a patient with agoraphobia who never leaves their house because they're so anxious about the world. And so a healthy level of anxiety is something that's totally normal, but whenever it's on one extreme or the other, we can kind of pathologize it. And approximately, I think, 20% of current Americans have an anxiety disorder of some kind, and 30% over the lifetime of a human being will probably develop some kind of anxiety disorder. So it's pretty prevalent, and that's kind of like the basic background for it.
Right, and we use the term anxiety, I think, a lot. We throw it around. It does apply to some, but it could be maybe something else for someone else. But you kind of explained it. Anxiety can be a good thing, which, like you said, what does it tell us? What's good about it, and what is it telling us about ourselves and how we're coping with things?
Right. So anxiety can be motivating, right? I mean, the thing that you feel anxious about, like, oh, I procrastinated on this, I need to go get it done, it actually can be productive for us. If you don't have that, you're going to be kind of lackadaisical. You may not have any anxiety. The classic example here is like depression. You're really unmotivated. You have no drive to do anything. Nothing can light a fire. But that can go too far, right? So you can have way too much anxiety. You can get paralyzed by it. And so it's one of those things that healthy in moderation, but you don't want too little or too much of it. And I'd probably just leave it there.
All right, Dr. Draghi, more and more kids, as we know, suffering from mental health issues. So what does anxiety look like in children? How does it differ from what we see in adults?
Sure.
Or does it?
Yeah, absolutely. We're seeing an increase in anxiety with our children and adolescents throughout the pandemic, and it's continued to increase. It looks similar in some ways to adult anxiety, and that's, your fear, your worry, some things that we kind of classically think with anxiety. How we see the difference in children is we often see difficulties with concentration, an increase in activity level. Teachers are reporting, well, they were doing really well, and now they're not focusing. Now they're bouncing off the walls in classrooms, things like that. We also see difficulties with sleep, irritability, anger, mood swings, these aggressive, some types of aggressions at times, as well as, just asking for reassurance, asking the same question to teachers, to parents, trying to seek that reassurance to decrease that anxiety.
Abraham, so the first episode is all about sports and mental health. We've been talking a lot about sports as kids head back to the classroom and back to the fields and the courts. You spoke with some local professional athletes. For all of the parents of athletes out there watching, what is your takeaway as an athlete yourself on prioritizing mental health even before the sport?
Yeah, so even as a former athlete, one of the biggest things that I feel like parents always miss is that the child actually has a voice and they actually want to communicate. And this is one thing, something that, unfortunately my own parents actually miss. The fact that I didn't even want to play soccer, but, I happened to be good at it, and I was pressured to play. But I didn't really know how to communicate because that space wasn't created for me to even have a voice, because I came from an African family. So you can either be a doctor or you be a failure. So, but with me, I was also dealing with a lot of trauma at the same time, from having a stutter as a little kid and then going through something very traumatic. And I didn't have a space to basically have this conversation with my parents because, again, the space wasn't created. And soccer became such a big, like a difficult thing for me to keep doing. But I had to because my parents wanted me to basically do it. So again, just having that conversation with our kids and making sure that we create that space, because even me now, I try to create that with my 4-year-old, which is also becoming such an interesting thing because he's so aware. Maybe I'm just saying that, but he knows so much and he has so much to share, which is sometimes overwhelming. But it's a good thing that I'm creating that because I didn't have that.
Well, yeah, kids know a lot, don't they? A
Absolutely.
lot more than you think.
Right.
Just a little 4 or 5-year-old, they know a lot more than we think, right, Doc?
Yeah, absolutely.
Amen.
They're cued into their feelings, their emotions. They show us signs that they're feeling this way. And so, like Abraham was saying, it's really important to open that space to be able to allow them to express their thoughts and their feelings and hear that.
Yeah,
So.
be looking for it. Like you said, open your eyes. Okay, Jordan has a question, Abraham. I'm going to give this to you. I struggle with mental health. I've struggled with it for years. How will the Freedom Project work to change the stigma around mental health? That's a big
Right.
mountain to climb. how is this going to help?
Yeah, so I actually love this question a lot because when I initially decided to go see a psychologist, I went because an ex-girlfriend kept telling me that I needed help. And luckily, I had that motivation to go and see a psychologist. But the process of trying to find a psychologist, I didn't even know what was the difference between a therapist, a psychologist, a counselor. So I was going to Google, typing therapist, and I would see a psychologist. And I was like, no, I need a therapist because my girlfriend says so. But so what I'm creating right now is to use video in order to help people understand what mental illnesses are all about. How do you find all this basic information that, in my opinion, I feel like usually the experts will miss because these are the basic things that are adding to stigma. Or when it comes to the intake process, usually you have to talk to almost 3 different psychologists before you even see the actual psychologist that's going to see you. So imagine you talking to the same person, 3 different people, and being vulnerable. Sometimes it can be very heavy for someone who already has this stigma to even talk about it. And then also another part where I'm using technology to basically create, which my really good friend Cody Isabel was able to explain, which is creating X-ray for the mind. Because when you break your hand and you go to every doctor, they'll say your hand's broken. But when it comes to mental illness, you can go to different psychologists or counselors, and you are being told you have different things, which maybe I'm not really educated on this aspect, but I want to basically simplify it so that we can eliminate stigma. And then using film to basically have those difficult conversation around what mental illnesses are like, and when it comes to parents as well, letting the kids have a voice as well.
Dr. Trivestad, I want to ask you, because access to mental health it's a problem for people, and just some of the things that Abraham just said, it's just like you said, you Google search something and you just there's so much to sift through. So how do we know where to go for help? What kind of help we need? Help us understand how to navigate through all that.
Yeah, so I think that's a multimodal question. So depending on the problem you're dealing with, it's one of those things that will kind of dictate the response. So, if you're feeling overwhelmed, if you're feeling, a little bit sad or a little bit depressed, that might be where you seek out just an office visit with a psychologist or a psychiatrist to see them in the office. If you're feeling more depressed or suicidal or thinking about taking your own life or having extreme distress to where you can't eat, you can't drink, that's probably where you want to come into the hospital and kind of seek out resources there. And so really the severity of your symptoms, and sometimes that's not best assessed by you. Sometimes you want to ask the people around you or people that are close to you to say, how do you think I'm doing? How do you think I'm functioning? And if they think that you've really kind of dropped off this metaphorical cliff and you're not functioning at the level you were, and it's that severe, you probably want to escalate that to a higher level of care, like an emergency room or an urgent care, for more thorough and efficient evaluation.
Well, and it's tough because what Abraham was saying, my ex-girlfriend told me I needed help. It's not easy to hear those words. I think you need help. So that's tough to do. But like you said, ask the people around you that truly care about you and love you. So, Doctor, I have a question for you. Cindy asked, how do you know if your kid is just sad or suffering from true depression that needs an extra level of help?
Yeah, that's a great question. I think that we all have times where we feel sad and we feel down. It's when these prolonged periods of sadness, of irritability, a change in the way the child is interacting, lack of interest in things they used to previously really enjoy engaging in. So it's these periods of time where you're starting to see a different kid for weeks and that sort of thing. And if you have questions, talk with the school counselor, the teacher, see if they're seeing similar difficulties in the classroom. Talk with your pediatrician. If you have any concerns at all, ask professional help, and we can help assess and treat.
Dr. Trivestad, what is the true definition of anxiety? You talked a little bit about it, but what should we be specifically looking for, and is there an actual definition that might distinguish it from all the other types of things?
Yeah, so unfortunately there's not. Anxiety is a symptom, and so we have specified diseases that kind of run the range of anxiety. So we have generalized anxiety, that's kind of an excessive worry about multiple things. And again, it impairs your functioning, right? So you can have normal worries that don't impair your functioning and you don't have a psychiatric condition. So we have generalized anxiety. I talked about agoraphobic agoraphobia earlier. That is literally a fear of pretty much everything in the world. So you don't leave your house, you're not engaging with people.
Very extreme.
Yep, extreme anxiety. And then you have other anxiety conditions in there. So trauma is one of those anxiety conditions that we've talked about a little bit this morning. OCD is technically an anxiety disorder also. And so we have this kind of wide-ranging definition of the symptoms of anxiety, and then they can fit into different boxes. But really it all comes down to functional impairment. So there's some other associated findings that go along with each anxiety disorder, but it really comes down to anxiety about something and then functional impairment, and then we can try to piece together what the other unifying diagnosis is from the other symptoms.
But you can have anxiety and still be functioning.
Yes.
Correct.
Yeah. And yeah.
Okay. So are you seeing an increase in anxiety in our kids, our young people, and do we know why?
Yeah, I think that there's definitely been an increase in anxiety with our children and adolescents. We've seen an increase since the pandemic. I think one of the positives of the pandemic is that it destigmatized mental health. So it's okay to not be okay, and parents are hearing that, children are hearing that, they're reaching out. There's also this is can be a trying time. There's a lot of anxiety for adults. There's a lot of anxiety for children. And so we are definitely seeing that. When the pandemic started, I saw that when we went to virtual learning, the social anxiety kiddos that I worked with, they actually really improved, which makes sense because they're not having to go and face this. So more of this their avoidance is able to occur. Then school starts back in person and the anxiety shoots back up. So we definitely are seeing this trend.
All right. I'm going to hang tight on this conversation. Let's get to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us on this Monday with our numbers. How'd we do over the weekend?
We're still doing pretty good. I'd like to say about the anxiety, certainly, as we heard when it started, the pandemic started, anxiety started, but also opening back up and going back out into crowds, I think, has induced some anxiety with people as well. So that's another active issue also. Right now, as far as infections in the health system, 27 active infections, 1 in the ICU, 3 on the ventilator, still 20 in that recovery period. But again, Jessica, overall reported cases and hospitalizations are on the downtrend. So hopefully we will get down into under 20 and under 10 into those single-digit hospitalizations fairly soon.
Yeah, we like to hear that good news. How are we doing with monkeypox? What do we know about those cases?
Monkeypox continues. The cases continue to increase, although not at the same rate that they were the previous 3 or 4, 5 weeks. And we know that we are continuing to give out vaccine. I think we've given just about 100 doses or so of the vaccine since we opened it up. So hopefully we'll continue to get more of those vaccine doses into people's arms.
All right, I have some questions for you today.
Yeah.
Let's stay on monkeypox for a moment. Multiple monkeypox vaccines and antiviral trials are being launched across and around the world. Explain how this works and why they're so important right now.
Yeah, they're so important right now because we really don't have any data about the current vaccines or the antiviral tecovirimat or TPOXX. Specifically in humans, we know that antiviral is safe from safety studies in humans, but as far as doing the actual analysis and trials for monkeypox disease and that antiviral, we are getting that. So we are going to be getting a lot of safety and efficacy data from that. I think that's good. But also even more safety and efficacy data for the vaccine as well. So all this is going to help with our understanding of the disease, but also the preventive measures and the therapeutic measures that we take against this disease as well.
Okay, there's an article that comes from one of your favorite publications called Nature. Could tiny blood clots cause long COVIDs? Puzzling. We've been trying to figure this out for a long time, this long COVID, all these symptoms that are being caused. Why would blood clots be to blame, and how would we fix that?
Yeah, I mean, certainly for things like brain fog, the blood clots, they will reduce the amount of oxygen. This is, one of the simple mechanisms would be reducing the amount of oxygen to your brain tissues. Those very, very small blood clots, we know that does affect other organs as well. And we are really looking at the reasons for the long COVID symptoms, for all of those symptoms. Some of them may have the same mechanism, some may not. The blood clots, we've certainly know that has been an issue early on, as far as looking at large blood clots, say in the lungs and in your leg vessels, but also now up in those smaller vessels up in the brain. So this is one more thing that we can look to try and then treat should it continue to be an issue moving forward. And I think we all fully expect long COVID to affect people on a daily basis for quite some time.
Okay, according to Quote Wizard, nearly 30% of potential college students in Kansas decided to not even go to college because of COVID-19, and nearly 50% of students in Montana, Tennessee, and in 8 other states. So what steps are being taken to make sure that campuses stay safe for everyone this coming year?
Yeah, you know, we know that the CDC has put out new guidance for keeping those people safe. What it does boil down to is your local community, say your county or your city, guidance on what are the rules or what are the restrictions on anything such as indoor masking or the amount of people in a certain area, but also it continues to go back to you as an individual, understanding your risks, understanding the important things about those pharmaceutical interventions like vaccine and being up to date, but also those non-pharmaceutical interventions, understanding what situation are you going to be in. Are you going to wear a mask? It's certainly always okay for you to wear a mask even though others around you are not, but also trying to do those other things, understanding the space that you're in. Are you in a large space? Is it outdoors? Is there good ventilation? And distance between other people. So, you know, college campuses, I think, as a whole, have done very good for identifying risks. We know that those younger age groups are at less risk of severe disease and hospitalization, but still are at risk, and it continues to boil down to you as an individual.
All right, Doc Cox, stick around. We've got
right.
some questions coming in for you today. Is anxiety genetic? Researchers say anxiety disorders are more likely to be passed down from fathers to sons and mothers to daughters. A study published in JAMA found children tend to pick up traits and model behavior after the parent of the same biological sex. The CDC found nearly 6 million children between 3 and 17 years old were diagnosed with anxiety between 2016 and 2019, just 3 years. So, Dr. Tyler Chervestad, is this a reminder to all of us that kids are kind of watching everything we as adults do? Are we modeling behavior for them?
Yeah, I think that is a good reminder. It's also a good reminder that anxiety, as you said, is genetic, and it also seems to have a sex prevalence. So females more than males tend to have anxiety disorders by about a 10% margin. And so, yeah, we're modeling behavior, we're passing it down in our genes, and so all of those are good reminders and good things to think about.
How do we break those habits? Any suggestions? Give us some tips.
I was going to say, as far as habits, I think that's where therapy is extremely helpful, right? So cognitive behavioral therapy is all about how your anxious thoughts may be making you behave in an anxious manner, and so that'll help you kind of become aware of those, change those patterns of behavior. But some of this is genetic, right? And so some of this is not modifiable, and so that's where medications can sometimes be helpful if we're trying to overcome some kind of genetic issue that may be causing chemical imbalances or other things. But therapy, as far as modifying behavior, is the best way.
All right, Tyler Draghi, right? I got it. Okay. So how often do you see evidence of kids feeding off parents when working with children suffering from anxiety? We always talk about kids absorbing their parents' anxiety and taking that on. Is that true?
Sure, absolutely. As a parent, it's distressing to see our child in suffering, feeling anxious, and so for a parent that has anxiety themselves, this becomes even more of a problem. In therapy, what we're seeing with parents, how they pass this down or their anxiety kind of feeds their child, is avoiding things that might make their child anxious. So not going out, not having them go to a birthday party because of the anxiety that creates. Also over controlling their environment, checking and making sure everything's okay every minute of the day. Also responding negatively due to our own anxiety to the child's anxiety, and minimizing those experiences and feelings. In therapy, what we do is we help with stress tolerance of the parent. And so how to identify when this could be a stressful situation for the child and for you as a parent, and how do we deal with that? The goal is not to eliminate anxiety, the goal is to manage our anxiety and teach that to our children as well.
Okay, so here's my asking for a friend moment. So are there any things that we should avoid doing in front of our kids, or conversations or things or buzzwords? I mean, when you live in a house with somebody, it's hard to shield them from everything. If something's going on with mom or work or something's going on, but how do you, is there anything that you can give us as far as what we should or should not do around our kids that might help keep their anxiety down and keep yourselves?
Yeah, and I think parents are the experts of their children. So one thing that might work for one family may not work for another. Some families are more open book in what they discuss and talk about, which helps the child's anxiety and their emotional functioning. And other families, they need to kind of have this more of an adult conversation. You know, the most important thing that parents can do is talk about their thoughts and their feelings. You know, times where they felt anxious and how they've managed that. You know, this situation came up, this is how I handled it. This may be the way I wish I would have handled it. So children are hearing it's okay to talk about thoughts and feelings and experience anxiety, but also ways that we can manage it. And we might not get it right the first time, but we can keep trying.
Just kids and mental health, it's just such an important conversation, and I think everyone's all ears when folks like you are sitting at this desk, because anything we can take away to help our kids out, especially right now, is it's big. It's big. So Abraham, I want to ask you, you have several episodes lined up. One of those is childhood trauma and mental health. Talk to us a little bit about your theme for that particular episode and kind of what you're finding out so far.
Yeah, so basically as a former kid, I have always wished that, I had the space to have that conversation with my parents. And, and I like to take things back to the basic, which is let's create space so that adults and kids can basically collaborate effectively. And that could look like, just having this conversation and letting your kid have a voice. And the reason why I'm even doing this episode, I guess one of the biggest reasons is because I became a dad, and I started seeing some signs of my own son and the way that he was behaving. But luckily, I was going to therapy, so I was able to have that conversation with him. Even though he's 4, he can barely say anything. But he says so much with the way that he acts, the way that he sometimes even yells. So, and these are little things that I'm picking up, so I'm learning from him as well. So it's not a waste of time giving your child a voice, because they say so much, but they don't say too much at the same time.
Yeah, lots to sort through with our kids, trying to read their minds and kind of let them expand. But it changes your perspective when you become a parent. I want to talk about a couple of medicines to treat mental health disorders. The FDA just approved the first and only rapid-acting oral medication for the treatment of major depressive disorder, or MDD. The time-release pill is the first medication approved to treat MDD in over 60 years, and it could hit shelves by the end of this year. It is not approved for children, though. There is another FDA therapy approved for treatment-resistant depression. It's called Ketamine. Am I saying that correctly? Ketamine? Nasal spray? Ketamine nasal spray therapy. The University of Kansas Health System is one of only a few hospitals in Kansas and in the Kansas City area that offers this therapy. So Dr. Shrivastad, you're the leading psychiatrist for this new outpatient therapy. Explain why the nasal spray is limited and where you can get it, and what do we know about the benefits of the pill?
Mm-hmm. So with the esketamine, or Spravato is the brand name of it, it is limited because it has some monitoring requirements. So it is a procedural intervention that's done in our outpatient clinic, but it requires 2 hours of monitoring for blood pressure, because the medication does affect your blood pressure, and so we wouldn't want to give it to you at home and then have you have elevated blood pressures or worse, some complicating side effect from it. It's only approved for treatment-resistant depression also, so it's a kind of a subset of a population, but that's why it's kind of restricted in its use, is just because of some of the more serious side effects that can come from it, as opposed to some oral medications.
So compare and contrast that to drugs like Prozac, Paxil, Zoloft, the ones that we hear about.
Yeah, so Zoloft, all Prozac, Paxil, all of those are serotonin modulating agents. Ketamine and this newer agent that we're actually talking about, Auvelity or dextromethorphan, bupropion, actually work on different receptors in the brain. So they don't actually work on serotonin at all. They work on anti-NMDA receptors, which is a completely different pathway for depression. And so they're kind of novel targets for treating depression, because as we know, about 30% of all patients with depression will not respond to standard of therapy, whether it's Zoloft or Prozac or Paxil.
So I know a lot of people going on anxiety medication for the first time in some cases. So how do they know what's right for them? What questions should they be asking their doctor, or is it really more doctor asking them the questions and making that decision? And if it's not working for you, is it okay to swap and go to a different direction and try something else.
Yes. With anxiety, I usually recommend a multimodal approach. Same thing with depression. So you want to combine a little bit of medication, a little bit of psychotherapy, and then if you can change your lifestyle a little bit, improve your sleep, maybe change your diet, exercise more. It's kind of a holistic approach to mental health.
Not a magic pill.
That's exactly right. So everybody comes in and they always want a single pill to fix, the depression or their anxiety, when usually those are symptoms of something much larger.
You let me know when you got one of those, okay? That would be great. Dr. Draghi, so let's talk about this with kids. A newer drug not available for children right now. So what can we offer children, and when is the best time to put a child on some type of medication for help?
Yeah, so as a psychologist, what we implement for anxiety is an evidence-based approach. Often cognitive behavioral therapy is the gold standard for anxiety disorders. So what that is we're teaching kids what are their stressors, how to know how their body is telling them that they're starting to feel anxious. What are their thoughts that are getting in the way? What are these negative and intrusive thoughts that they're experiencing? And then coming up with coping strategies that we can implement and put in place in the real world so that they can practice decreasing that anxiety. We also, for children with anxiety, do a lot of family therapy, working with families, talking about how to encourage implementing coping strategies at home, how to monitor a child's anxiety level, and strategies that parents can do. We'll also talk with the schools about strategies in the classroom that teachers can implement to help decrease a child's anxiety. Where I start to question and possibly refer to a psychiatrist for medication is due to the severity of the anxiety. Is our work being compromised by the child's anxiety is so high that they're not able to learn and access these strategies that we put in place during therapy? Is it debilitating? Are they not able to go to school to do any sort of previously enjoyed activities? Are they just staying in the house? If it has that severe of an impact, then we consider referring for medication.
Great questions coming in today. Catherine wants to know, how is a physical chemical imbalance in the brain diagnosed?
So we should probably be very clear that it is not technically a chemical imbalance. So a lot of this is a misunderstanding. There was a lot of fallout from this recently within the last couple of months as a paper was published. So just because we're modulating serotonin in your brain does not mean we're actually changing the chemical nature and the chemical balance to a certain level. So we have measured and done studies that have basically looked at the level of serotonin, dopamine, norepinephrine in the brain, and those do not predict nor correlate with disease severity. So really what's going on with these is an adaptive response to a stressful environment, and your brain is changing how it's processing that environment. What the medications do, and this is why they take so long to work, right? So if it was a chemical imbalance, we could probably recover that in a couple of days, but it takes weeks, and therapy is the same way. It takes weeks to maybe a month or more to really restructure how you're engaging with your environment, interpreting those signals that are coming in, and then basically manifesting the behaviors that are going out that are different than your anxiety or depressed states. And so it's not so much a chemical imbalance. I know that's kind of the unified theory.
People use that term a lot.
They
Somebody
do.
has a chemical imbalance, but that's not necessarily
no.
the thing.
So it's an easy explanation, but it's not the complete story. So again, like I said, there is not a chemical imbalance. I can't do a blood test or even like a CSF test to test your brain fluid and see if there's a difference in the level of serotonin or other neurotransmitters that will predict if you're going to be depressed or anxious. Really, it is that functional impairment, and then the medications act on the nerves, but that causes structural changes in the brain that allow you to better cope and adapt to your environment.
Jean wants to know, do you have any suggestions about reducing anxiety without medication? I'd like to hear from all three of you.
I mean,
can start.
As I already mentioned, changing your diet, exercising, getting good quality sleep, all of those things will go a long way to just reducing general anxiety, and then just becoming more organized if you can. That's really the biggest thing. Anxiety usually comes from those stressors when we feel like things are out of our control or we're overwhelmed. So trying to get organized, have a schedule, do all those things can be very helpful.
Anything to add to that, or anything specific that might apply to kids?
Yeah, I think that just very similar to what you're describing is healthy eating, sleep, limiting screen time, and opening that space to have conversations about that. Labeling anxiety, name it to tame it is what we say, is that you name that this is anxiety, this is how we're going to address it as a family together.
Name it to tame it. I like that. Abraham, can you add any advice to this conversation about just ways to reduce our anxiety without medication? What have you found to be helpful in your journey?
Yeah, so I like trying not to get on the medical aspect because, that's not my expertise. And the reason why I even created the Freedom Project is to act as support for the experts. And the support could look like us just telling the story to make sure that the conversation is very clear and very concise. And I use experts like Dr. Tyler himself. Thank you for being part of the Freedom Project, Doctor. And just letting them tell the actual story in a very, like clear way so that people know what they're dealing with. And another way of support is, I also try to work with state representatives to basically make sure that we are creating legislation around education so that kids can start learning at a very young age. And the reason why I'm doing that is because as a kid, again, I didn't know that I was dealing with all of these mental illnesses. And I've always wished that I was, educated properly so that I can tell the parents and be like, hey, this is going on. What can I do? And I also want to make sure that, psychologists also have resources when it comes to them practicing, because at the end of the day, they're also humans. They have to go home and deal with their own problems at the same time. But we sometimes forget that element. And I want to, I'm like very focused on like licensing right now to figure out how we can make that completely like, like universal, so that costs can go down for day-to-day people that are trying to get access to mental health services. And also psychologists don't have to feel, bad for just doing their job. Because I've had a lot of psychologists tell me that they hate the fact that they have to charge X amount of dollars because they know that some of these people need their services and they're desperate for their services, but they also have to pay, their rent and livelihood. So again, just support for the experts. And I'm hoping with that support, we can reduce, just crime around communities and make sure that we're having conversations as we try to figure out, this very complicated problem.
I want to get to a couple more questions before we wrap up. Dr. Draghi, help this listener out. My daughter has anxiety that is both probably a genetic trait, but also she has a severe peanut allergy that she's had her whole life. She has just gone back to school in person after 2 years of virtual school, and her anxiety and mood swings seem to have returned. She did well virtually, but then they were concerned about keeping her so isolated socially. Is it okay to keep kids virtual if it helps with their anxiety symptoms? Would you recommend that, or what would your advice be?
So my advice would be I think in talking with the therapist and in meeting with the therapist, sometimes that can be avoidant, and avoiding can have short-term benefits, but it actually can create, it can grow that anxiety. And so it can make it even more challenging than to jump back into the classroom setting. So working with a therapist and doing cognitive behavioral therapy, what we call exposure therapy, and being able to start these small incremental strategies and approaches to addressing anxiety would be beneficial. And so it really is not a one-size-fits-all recommendation. It really is dependent on the child, what they're working on in therapy.
It's tough. Yeah, we want the magic pill. We want the magic answer for all of us, and it's tough. It is not easy. Yen Liang wants to know, and this is probably applies to a lot of us, would the overuse of smartphones and computers lead to mental problems for adults or children? Anything you could add there?
I think that debate is still out. I definitely think some of the aspects of social media and high levels of phone use
and the content
can correlate exactly with anxiety and depression, but I don't think a blanket statement of this kind of goes back to the old adage of TV. Whenever you let your kids watch TV, clearly if you're letting them watch 18 hours of TV, that's probably not great for them, but is 2 to 3 hours? I think the evidence on that is not clear at all. And so I think this is one of those areas where we have to be comfortable as providers saying, I don't know how much is too much, but clearly if it's causing them significant distress for your individual child, you might consider modulating how much exposure they have to those things.
All right. Anything, kids, parents are always hearing, I just went to our doctor last week and that was one of the questions. How much phone time are you getting? How much screen time? So it's again, finding that magic balance, right?
Yeah, it's really challenging to find that balance. With the social media, people are watching everyone else's highlight reel. And so there is that propensity for depression or anxiety or that, fear of missing out. And so continuing to monitor that as a parent and having these open conversations like we've discussed really will help you cue into what the impact that may have on your child.
So you're saying not everybody's life they portray on Facebook is exactly what it is, right? Not everybody's life is perfect. Last question is, can ADD, ADHD occur together with an anxiety disorder? And does that make it harder to diagnose?
Mm-hmm. Yeah, so you can definitely have both. The thing that whenever you come in for a diagnostic eval, at least from the psychiatric side, what we're going to try and parse out is, are concentration symptoms that you're expressing due to the anxiety predominantly, or is there some other concentration disorder that's there? And so anxiety can impair your concentration. And so typically what we do is, because our medications that we use to treat ADHD are very activating, so they can actually worsen anxiety, we'll try to get your anxiety under very good control first, whether that's through therapy or other medications, before we would start a medication for ADHD. But yes, they can co-occur together. All kinds of mental health disorders can occur together with anxiety, and makes the picture a little muddy, but we can figure it out.
Sure. Well, and we just talked, this is such a great conversation, because we talk and address mental health a lot, but not specifically anxiety the way we have today. So that's been really nice, because I think we all probably have some, or somewhere on that curve. I want to get to our final thoughts today. And Abraham, I'm going to start with you, and I'm just going to start you off with Joellen's question. Where can I find out more about your project? And what else do you want us to know?
So we're very accessible at this point, because I've tried to make it accessible as much as possible. So we're on Facebook as Freedom Project, and Instagram as well, YouTube, pretty much everywhere at Freedom Project. And the shortest way that you can find us is FPFOR. Sorry, that's wrong. We just changed that 2 days ago just to make it easier. But it's FP Forum KC. So you can find us basically anywhere.
Any final thoughts you want to share with us before we go?
Yes, definitely. I want to piggyback on what you guys talked about on the technological aspect of stigma, because as someone who is in the tech space, this is something that I hear all the time, which is, this is going to affect kids. I'm just like, no, too much of anything can be bad. And right now I am seeing, especially on social media, Instagram, TikTok, I see a lot of people that are self-diagnosing, and these people have millions of followers, and that can be very dangerous very quickly. And sometimes we would see comments of kids, 15 and under, just basically identifying with whatever this person is saying. Not that, they're bad or anything. It's just that they don't know even how to go about, having this conversation around mental illness. So to me, I'm very focused on the conversation, the education, to make sure that we're not having someone with a 2 million follower just saying whatever, and then applying that to the the 2 million people that are following them, because I believe that can be very dangerous. So that's where the focus is, making sure that we're not letting just basically people understanding what's the best way to have this conversation. I hope that makes sense.
It sure does. The documentary is called Freedom Project. Abraham, thank you so much. We're looking forward to this documentary and this series, and we appreciate all the work you're doing.
Oh, thank you. I appreciate the time.
Dr. Draghi, yes, let's go to you now. The final thoughts for us today.
My final thought is it's okay to not be okay. And so parents, talk with your kids, ask them, how you doing? Check in, how are you feeling? Open that space and listen. Should you have concerns or things like that, seek out professional help. We're here to help and can make a difference.
What did you say? Name it to tame it?
Name it to tame it.
I love that. Identify it and start getting help for it. Final thoughts, Doc?
Yeah, so I think in mental health disorders in general, just know that we're here for you, and we'll try and help you figure it out. And if we can offer any treatments, whether that's therapy or medications or whatever, we'll be here to discuss those options with you. In regard to anxiety in general, I think if you're really struggling with that, please seek out care with psychology or psychiatry, and we'll try and help you become a little bit more courageous instead of a little bit more anxious. And so we may not be able to remove the anxiety, but hopefully we can change your response to it and make you a little braver in the face of it.
Give you some tools, some good coping tools. All right, thank you so much, all three of our guests. Dr. Hawkinson, wrap up our final thoughts today.
Just thanking our guests and kind of echoing everything that we've heard. Anxiety is such an incredible issue for a lot of people. Again, we heard about the beginning of the pandemic creating anxiety, but also now creating anxiety as we are opening back up and getting to more normalcy as well. So I just encourage everybody, just as you're going to be doing vaccines and your testing, your screenings, really try to get that access to mental health and emotional health assistance. It will pay off, and it is difficult, as we've heard, but hopefully we're making that easier for people to get.
Thank you for that. Finally, this morning, Chiefs and Kansas City legend Len Dawson is giving back to the health system even after his passing. In lieu of flowers, his family is asking you to donate to the health system in support of nursing scholarships. Here is some information right here on your screen. You can send that to Fund Development. They're in Westwood. Donations can be made online also at giving.kansashealthsystem.com or to Kansas City Hospice. His memorial service will be held on September 16th at the Country Club Christian Church in Kansas City. It's at 11 a.m. It is open to the public. Len Dawson died last Wednesday. He was 87 years old. Thank you so much for being with us today. Don't forget you can catch our shows anytime by logging onto Facebook, YouTube, and on Twitter. Coming up tomorrow, we look back at the evolution of COVID and the vaccine with the current director of Mayo Clinic's Vaccine Research Group, Dr. Gregory Poland. That's Tuesday on our Encore presentation. But we'll see you back here live Wednesday for Open Mics with Dr. Seitz at 8 a.m. The number of women in prison has increased by 475% since 1980. Coming up on the next Open Mics with Dr. Seitz, we go behind bars to talk sexual health with incarcerated women. Find out why population health experts say the work is vital for these women. Wednesday at 8.
Subscribe to our morning medical update and Open Mics with Dr. Seitz podcast. Now, everywhere podcasts are available.